Now, the coronavirus can affect anyone, but older adults over the age of 60 are most likely to get sick from it. Joining us now is the president and CEO of Serving Seniors, Paul Downey. Paul, good morning.
Good morning, Christina.
Thank you for joining us. This is such a big deal. I think about like grandma, grandpa, when I think about the coronavirus, and there are specific precautions older adults should take to protect them during this time. So what are some of those precautions that apply to this age group?
Well, I think particularly being aware that they are at risk. Being over the age of 65, having multiple chronic health conditions puts you at much more significant risk. So all of the standard precautions that we've already been hearing a lot about. They need to be washing their hands. They need to be not touching their face. They need the social distancing of at least 6 feet. They need to, frankly, stay away from younger people who are out and about, potentially who have caught the virus, may not be symptomatic. There was a study that came out just yesterday out of Iceland where they tested a whole lot of people and discovered that a significant portion of the population was carrying the virus but was not showing symptoms.
And didn't know it.
So for a younger person...
I'm so sorry. Just real quick, does this include doctor's appointments?
Yes, if it is not a mandatory, urgent issue, life and death issue, if it's a routine, you should be skipping the doctor's appointment and doing it via phone or Skype, if your doctor will do that. I obviously consult with your physician, but skipping, a non-essential appointments is very, very important.
Okay, and then how about
of any sort, not just a doctor,
right?
But going to the hairdresser, the barber,
right.
Anything that you do not need to do if you're an older adult, you should not be doing.
So anything that is non-essential. How about, because when we are self-isolating, obviously we're at home. And so when I think of grandma and grandpa, did we lose him? Okay, so we lost him. Hopefully we can get Mr. Downey back for us. But this is obviously one of those topics that we're all thinking about. Chrissy, I think about, okay, did we get him back? Paul, can you hear me?
I can hear you.
Okay, perfect. So I was just going to ask you, when you think about, the elderly staying home, one of the things that we want to make sure is that they're still eating right and exercising as well.
So one of the things that we're doing at Serving Seniors, one of the things is we do food delivery. So over the last week, we have more than tripled the number of meals that we're sending out. But we're now at capacity. We're doing about almost 4,000 people will receive food today. And I want to put out a message to folks who receive food from us. We have gotten permission. We are a critical, essential service. But there are a whole lot more older adults who do not receive our services or one of the other providers. So if you're a neighbor, a friend of an older adult, I strongly encourage you, help them out. Go to the grocery store for them. Make sure they have the essentials, things like toilet paper, like toothpaste. Those are things that they need. If they need a prescription refilled, help them out. We need to be good neighbors more so now than ever before, because again, older adults should not be going out. I think another very important thing that we can be doing is staying in touch. Many older adults live alone, and part of their social existence is going to the grocery store, going to the barber, and interacting with folks, maybe going to the local coffee shop. They can't do that. So make a point to knock on the door, stay 6 feet apart, make a phone call to people, but it's really important that we avoid the isolation. The doctors, and we're in daily contact with physicians advising us, say that exercise is okay. It's okay to go out and take a walk your dog, and older adults should do that. Just being very cautious about keeping their distance. And if you go out, if you even come close to touching anything, make sure you're washing your hands. You should have hand sanitizer in your pocket. Use it often. The doctors have told me over and over and over again with our population, the single most important thing is washing your hands.
That's right. And you know what, you bring up a great point. It's up to us, especially for the younger generation, to make sure that we are checking in with our family, our loved ones. And it's also important for, grandma and grandpa to know that, hey, if you need help, don't be afraid to call and ask for help. But Paul Downey for us this morning, thank you so much for joining us and offering that information for us.
Appreciate it. Thank you.